On this episode, we're going to talk about migraine headaches, some of the causes that you've probably never heard of, and a quick and easy way to fix it. So stay tuned. So maybe you've been suffering with migraines for years. I see a lot of younger kiddos, like 15, 16, 17-year-old kids that have just debilitating migraines. Maybe it's been going on for decades for you. Maybe you're an adult that you've got to go hide in your room, hide in the dark, turn off all the lights and stay away from everybody. Headaches are, and migraines specifically, are common in the population, but it's not normal. So I want to go over a little bit of the causes that maybe you've never even heard of before and some things you can do to fix it. Specifically in terms of cause, I want to talk about the upper neck. There's some really cool research that's been coming out in the last few years. Specifically, Gary Hack is one of the guys. He's a dentist, and it talks about tension that can be put on the actual spinal cord in the upper cervical spine when the bones are out of alignment. So Gary Hack specifically talked about a little muscle dural bridge that attaches in that area. So if you can imagine, when the muscles of the upper neck around the atlas and axis are tense, it can put tension on the actual cord. Well, the sleeve in that area that surrounds your cord is very, very nerve rich and very sensitive. So what they did in that research was actually cut that little tissue in there. And what they noticed was relief in migraine patients from doing that. Now that's one approach. What I think is really cool is that it points out that dysfunction here and tension on these tissues can cause migraine headaches. Another approach that is a little bit less permanent in terms of cutting tissues is to realign the structure, specifically the atlas and axis, the top two bones in the neck, back into more normal alignment to release them and restore their proper alignment underneath the skull, thereby releasing tension that is on those tissues. We have a lot of success with patients that are experiencing migraines because when you restore the more normal alignment to that area, those tissues have the opportunity to relax. So beyond actual tension to the nerves or the dura, that sleeve around your cord, secondly, I'd like to talk about briefly blood flow that enters the skull. Through the atlas and axis, those top two bones in the neck, is the blood flow, right, that feeds into your skull. They literally call them the vertebral arteries because they run through the bones, the vertebra. So if you can imagine having rotation, misalignment in that area of those bones, it's not going to lend itself to optimal blood flow into the skull, which is what you want. So potentially if you tend to have blood flow type headaches, you would want to release and open up that area to restore optimal 100% blood flow into the skull. So I hope this has helped you understand some of the root causes behind migraine headaches in terms of tension on the tissues up around the upper cervical spine as well as blood flow. I want you to know that your body is designed for normal function. So if you are experiencing this kind of misery, even though it's common, it's not normal, and your body should be expressing normal pain-free function. So it's a good indication that you should get it looked at and see if there is a problem with the alignment of those bones up around the brainstem there. As always, a consultation in the office. If you want to sit down and go over your history and see if you're a candidate for this kind of care, it's always free. So there's no stress there. So I want to encourage you to give us a call. Other than that, I hope to see you at one of our next free workshops if you want more information. Thank you for watching, and please subscribe. Thank you.